and health promotion, it's going to happen at a household, it's going to happen in our communities. Therefore, the investment that needs to go in there is what we've removed within the healthcare system. Fortunately, our own healthcare workers who took us to court, by the way, they won the case and we are absorbing into the system. But for us, we do believe in that system. So it means we now have a cadre of 27,000 field community health workers who are going to be driving prevention, health promotion at home. That's the first reform. And we need more than that, and we need to invest more. So that would be the first area as the future of where we're supposed to be going. The second point is that then empower the communities themselves. And I think the role of innovation, when we talk about innovation, we always talk about it from health, from the biomedical. We don't talk about it from a perspective of innovation within our communities and using the AI and all the tools that we have so that we reach all the individuals with the technology that we have, which means we can even tailor-make the services and our health education to the individual because we have the data to be able to do that. That's our next future, which I think talks to the future of where we want to be. The third area is then having the efficiencies. Now, the efficiencies are a serious challenge, which we saw with the donor funding. Some of the donor funding created parallel systems. I'm not sure again on other countries, but we know we had those parallel systems. And now we are going back into our own health system and saying, integration would mean if I'm working in programs, for example, I'm dealing with HIV, TB, malaria, STIs, I should be integrating with the colleagues who are dealing with NCDs, who are dealing with mental health, and all of us are saying, what is that single system that is delivering at a primary health care? And it's only when we do that are we going to realize the efficiencies. The third area around the funding now, which is another area that we are talking on NHI, funding would be domestic, as I've already indicated, from a country perspective, we are putting a lot. But there's a funding that comes from the donor. Who is accounting for that funding? Now, when we talk about accountability, it means all of us have to account. So what we are looking at now internally in the country, say within health, let's have that coordination, and then we all account, donor, public, private, but together as well, working with the AIDS Council at a national level is to say, from a multi-sectoral point, we all have to account. So that accountability mechanism is also being looked at as a process going forward. I think the last issue for us is, I'm going to stress, is the issue of those strategic partnerships, which means we are sitting here, we are saying the regional development organizations, our own private sector, we saw it coming now with the Global Fund replenishment. How do we bring them on board? But when they come in, it shouldn't be to create a parallel system, but it should be coming in an integrated manner. So that is one area also that our future is going to be. Lastly, our communities are still our best way and investment. And I think if we don't realize the role that they can play in ensuring that we deliver this health system, because a curative healthcare will never be affordable. It can only be the promotive prevention and health promotive type of care that will be affordable within the insurance. Whereas I think the reforms will be coming. I'm still waiting for a similar Abuja declaration that would happen, which means it has to be these stakeholders that are here that will start to drive the issue of health system that is for our people and the finances that we are all accountable for. And let's address the issue of localization and the issue of commercialization of health. It can only be done by a multi-sectoral stakeholder. Thank you.
Thanks a lot. Thanks a lot, Dr. Vikele. One last for all of you. Considering this future frontier and this perspective, what will be the strong recommendation, one strong recommendation you will formulate for SA and ICASA if they want to play a catalytic role in this dynamic? You can start. Check if you want.
Okay, if I'm starting. I actually believe it's a similar role that they played when HIV it was in denial. It's a similar role that we need right now, where we are seeing for us to have equity and social justice in terms of health, we need the voices of the multi-sectoral stakeholders that are here. And I think SAN would be the real organization that should be able to be driving the integration we are talking about, driving the issue of finances, driving the issue of localization, and pushing, because there are people out there who would go against this discussion on the basis of the profits that are being made out of the health system. So it will take us collectively to be able to say, and the role of SAN is to say, let it be also be an engine that started in that year. They still have a role even now. Thank you.
So the role of ICASA.
ICASA comme son organisation, parce que ICASA c'est la plateforme, la SA c'est l'organisation. Quel rôle catalytique ces deux-là, l'organisation et la plateforme, pourraient jouer justement dans cette dynamique et ces perspectives qui sont en vue?
Yep. Okay, so I think ICASA started off as an organization.
Juste une recommandation
Yeah,
forte.
yeah. So it's disease focused, and in today's world, we realize the importance of gender and human rights. So one recommendation is to have an approach which combines or mainstreams human rights, gender into all approaches to disease control.
Merci beaucoup.
For me, I think the key role for ICASA as a platform, a multi-sectoral, multi-country platform, is for high-level advocacy to institutions in Africa, starting from AU, to take positive stand on ensuring we own the management of disease conditions on the continent, to also give clear strategies for what has worked over the years, and especially for countries to take ownership and take a stand together, one, to say we want to take responsibility for our people. We want to ensure we care for our people in the way we understand it, because no system does not like his or our own child to care for it. That in Africa, we want to care for our people the best way it works for us. And ICASA as an advocacy tool to take leadership and talk to the platforms for government across all sectors, especially health sector on the continent. Thank you.
Thanks a lot. Please help me to applaud really strongly our three panelists. Thanks a lot. But I can't conclude that session without asking the elders. We are in Africa. During the first session, you have the monument. We are lucky to have them here. In Wolof, they said that a young man could climb the tree being up, and the old man is down and can see what the young man, even his high, could not see. We're talking about perspective, Dr. Michel Sidibe. You know the past, you know the present, and you were strongly blessed to give us advice, especially for SA and ICASA in perspective of the new frontier or the future frontier we envisage. Merci beaucoup, Michel, de votre présence et de votre générosité pour partager avec nous.
Thank you very much, Innocent. It is a very difficult task. My father used to tell me, you know, advice from someone else is like a big garbage. But even in this big garbage, you can find something useful for you. So I want to have a humility to say that after listening this very good panelist and also the past and all the 3 days, that my reflection will take into account all those different intervention and perspective. If you allow me, uh, just taking some stock of what I've been seeing for years, it's almost 45 years that I am in this global space of global health. Uh, and I want to say that ICASA, if ICASA was not existing, we would have reinvented ICASA because ICASA was a very unique platform which could really bring all those different groups, even though, like if you said rightly, that it was starting with scientists and others. But the social movement imposed themselves. And we move out of that to really not look at it as a disease like you were saying, but we try to look at it like Sheikh was mentioning on more horizontal manner. So for me, after saying all of that, ICASA honestly must evolve from the largest HIV conference in Africa to become a continental engine. You use the word, I like that one, for moving beyond visibility to impact. And that is, for me, very, very, very important point. It means that we cannot continue to just have a number and bringing a lot of people and be satisfied that we achieve. But ICASA today, people are looking for certainly as a platform more than that one, an engine, which will push for producing results in a different and create impact. So that for me is a very important reflection we need to have. Second reflection, I think it should be an engine driving measurable progress. Is I had a lot of discussion. We have but we need to be able to really be taking out of here few things which can really help us to push our political leaders to say that, oh, that is the voice of the continent. It is not just a voice of scientists or others or coming from US or others. It's a voice of a continent on critical areas where we need to make a difference. And that should be captured and I think is important for me. I think it should be also an engine, from my point of view, capable to turn a commitment into some co-investment. And that is the most difficult part because we are all seeing resources going down, things are coming, but how we can really use this type of platform to identify what type of new mechanism can come out for financing this universal health coverage, whatever you want, and link that to, of course, financing some disease. So for me, that's, you cannot have this type of big thinkers coming and not having those type of platform which can help us to make some kind of difference. But at the end, like I said, I think of the point which is important is making community voice, continue to make those voices accountability in action and not miss that one and trying to capture that strongly in our discussion. But I will advise to trustees and others really to have a small group which could be put in place to reflect more seriously on after 35 years and 23 years of international conference, what it means in this current political and geopolitical environment. So that's what I will add to excellent discussion. I was listening with a lot of interest. Thank you.
Merci infiniment. J'aurais eu tort hein, si je n'avais pas insisté pour vous donner la parole. Merci, je voudrais vraiment qu'on applaudisse. Cher, merci infiniment. Docteur Fikele, merci, merci. Docteur Timka, merci, merci infiniment. On va prendre une photo et je vais demander à notre ami Léo donc, de nous faire la synthèse et puis je crois qu'il y a une suite, hein, Léo. Il y a quelque chose qui va se... Ok, parfait.
Colleagues, I think it's been a wonderful, wonderful session. I see Professor Morenike say we should clap. Let's clap for ourselves. I think it was good. And we did achieve the objective that we had, so from the foundation to the legacy, we also have some strategic direction, so from SA and ICASA, building on what Peter Piot has shared in his last slide, and also what Michelle has provided in terms of guidance. I want to thank the speakers, the organizers. Sir, again, thank you so much for allowing Dr. Murphy and I, so to support Sir in this process. We remain available, so should need be. Michelle, thank you so much for being patient, so it's always good to have you around, so you may say, well, I have a sense of wasting my time, but just like Innocent say, we're here still struggling, and you see in 5 minutes, you can capture the environment and really provide us, so strategic direction. We'll continue to build on your wealth of experience and knowledge. Thank you so much, President, and then good evening. Thank you.
Monene no samanga dunyinka. Ayoe kukunga wasenga. Unyenge mwapa moto. Maninyanga tingemba musuka.